Welcome back to the Nurse Intelligence Podcast, where we talk about nursing, intelligence, and all the ways we keep the healthcare train from derailing. I'm your host, Teach, yes, just call me Teach, your friendly neighborhood nurse with a stethoscope and a whole lot of stories. So, let's dive in with a little something every nurse knows too well: loopy patients. You know the type. They're climbing out of bed, talking to people who aren't there, or seeing pink elephants on the ceiling. What do? We break out the secret weapon, vitamin H, Haldol. It's like a spa day for their neurotransmitters. One moment they're reenacting a soap opera, and the next, they're snoozing peacefully. Bliss, right? But here's the thing. While vitamin H is our go-to for those moments, there's a different kind of hallucination we need to talk about. And no, I'm not talking about Mr. Smith seeing aliens in the ICU. I'm talking about AI hallucinations, when artificial intelligence starts making stuff up. What are AI hallucinations? Okay, let's break this down. AI hallucinations are when your handy-dandy AI spits out something completely false, irrelevant, or fabricated. Picture it. You ask your AI buddy for the latest clinical guidelines, and it tells you to treat sepsis with Gatorade and a foot massage. What? Even the smartest AI models out there hallucinate about 2.5% of the time. Doesn't sound like much, right? But when ChatGPT handles 10 million queries a day, that's 250,000 hallucinations. And in healthcare, we don't have room for oops. Why we can't tolerate AI hallucinations in healthcare. Here's why this matters. Healthcare isn't the place for close enough. If AI hallucinates in a game, you get a laugh. If it hallucinates in healthcare, people's lives are on the line. Imagine an AI incorrectly approving a drug interaction or misinterpreting an early warning score. That's not just inconvenient. That's malpractice waiting to happen. As nurses, we're the boots on the ground. We know when a treatment plan doesn't pass the sniff test, but we can't babysit AI all the time. The solution? It starts with us demanding better. We need to articulate this to tech developers. Accuracy isn't optional in healthcare. What nurses can do. So, how do we fight back against hallucinating machines? First, we educate ourselves. If you're working with an AI tool, know how it works, what it can do, and where it's likely to mess up. Second, we advocate for better training data and stricter evaluations. Lastly, remember, AI is a tool, not a replacement for clinical judgment. Keep that critical thinking sharp, and don't be afraid to question the machine. As we like to say, garbage in, garbage out. If AI starts spouting nonsense, call it out. Politely, of course. We don't want to hurt its synthetic feelings. Enter RAG, the AI accuracy booster. All right, folks, let's talk about a superhero in the fight against AI hallucinations. No, it's not another dose of vitamin H. It's something called Retrieval-Augmented Generation, or RAG. Fancy name, right? But don't let it scare you. It's basically like giving AI a cheat sheet so it doesn't make stuff up. Here's how it works. Instead of having the AI generate responses purely from its training data, which, let's be real, can sometimes be a mixed bag, RAG links the AI to a knowledge base. Think of this knowledge base as the smartest, most fact-checked library you've ever seen. When you ask the AI a question, it goes, "Hold up, let me check the library first," and pulls relevant, accurate information before answering. This makes the AI way less likely to hallucinate. Why the knowledge base structure matters. Now, here's the catch. RAG is only as good as the knowledge base it pulls from. If your knowledge base is a hot mess, outdated policies, poorly labeled documents, or irrelevant data, then the AI is going to be as confused as a new grad nurse on their first day in the ICU. A well-structured knowledge base is like having a perfectly organized med cart. You know where everything is, it's labeled correctly, and it's ready to go when you need it. In contrast, a messy knowledge base? That's like finding syringes mixed in with tongue depressors. Chaos. how nurses can help build better knowledge bases. Here's where we come in. Nurses are documentation ninjas. We know what's critical, what's fluff, and what's downright dangerous if it's missing. If you're involved in setting up or managing an AI system at work, speak up about the structure of the knowledge base. Insist on 1. Accurate content. Only include verified, up-to-date guidelines and data. 2. Clear organization. Group information logically. Think patient care protocols, medication guidelines, and safety policies. 3. Searchability. Make it easy to find what you're looking for with tags, categories, and keywords. The better the knowledge base, the better RAG works. And when RAG works well, we all win. Nurses, patients, and yes, even the AI. So, next time someone talks about AI hallucinations, you can say, what that machine needs is a solid dose of RAG and a nurse-approved knowledge base. That's it for today, my friends. Remember, whether it's loopy patients or loopy AI, it's all about staying sharp and keeping your humor intact. If you've got questions, stories, or a wild AI hallucination to share, hit me up. And don't forget to subscribe, because next week, we're diving into the wonderful world of nursing apps that don't make us want to pull our hair out. And before you clock out, make sure you join the Nurse Intelligence Network, because we got your back. Until then, stay smart, stay safe, and stay sassy. This is Teach, signing off.